What if you were told that your thyroid was failing at just 21 years old? In this episode of What's My Body Telling Me, I sit down with Melody, a young woman who trusted her intuition over a lifelong diagnosis. Her story is one so many of us can relate to, being told, just take the meds, without anyone stopping to ask, why is your body out of balance in the first place? Melody's story will walk you through fatigue so deep she had to nap on the side of the road, irregular periods, being told that she would probably need IVF to fall pregnant, to uncovering sky-high thyroid levels, refusing that lifelong medication was her only option, and instead working with her body through functional and energetic healing. And then pregnancy, birth, postpartum, the whole journey shared honestly, symptoms, emotions, and what her body is telling her now. This one will leave you both informed and inspired. Let's dive in. Melody, thank you so much for joining us. I know that a lot of the listeners are going to get so much out of your story. I know I personally have too. I wanted to start with why you decided and agreed to share your health story with us today.
Thank you, Anthea. I decided to share my story today because I see so many other women around me suffering or having health issues that they can't get to the bottom of. The doctor doesn't give them an answer, but they know that something's wrong. Or the other case is they don't want to go on a medication for the rest of their life that's been prescribed to them, and rather to fix the issues. But again, with some actual medical understanding around it, rather than a whole new age, just try this, try that, go on this diet, that sort of outlook. So as you put it in your book, I think the space in between.
Yeah, exactly. And that is where we find ourselves a lot, is where I don't necessarily want to take maybe this medication or surgery that they've prescribed to me, but have said I'm just going to have to be on it for the rest of my life. I want to understand why I'm feeling how I'm feeling without having to go wade through all of the cluster of information that's in that health and wellness industry. It can be really overwhelming and confusing. So I'm so grateful that you're coming on today to share your story, because that's exactly what you've done. So where did it all begin? If we start way back in the beginning, walk me back into when you first started to know something wasn't quite right with your body.
So it was soon after I was married, and
How old were you then?
21, and I started working at a cafe in the town that I had moved to after my marriage. And I was feeling really, really fatigued all the time. I would sometimes micro sleep in the car, which is not a good idea. I ended up having to stop on my drives home and take a nap because the drive to and from town was about an hour. And so I knew there was something wrong, but I thought, everyone gets tired. Perhaps I just need to do more exercise, or those other things that we're recommended to do: sleep more, exercise more, just those sort of general principles of getting your system up and going. But I went to the doctor for another problem that I had, just an infection I had. And while I was there, I asked the doctor, look, I'm feeling fatigued. Perhaps this is an iron deficiency, because that's the other thing I'd heard about, that iron deficiency can lead to you being fatigued. And she just mentioned, this might be thyroid. And I was like, oh, okay, you can test for that too. I don't know what that is. I don't think it'll matter. I don't think there's anything wrong with me. I just think probably I just need to have more iron or something like that. But when the test results came back, it showed that my thyroid levels were way off, as you well know.
Yeah. So for those listening, Melody first came to me. I actually worked with Melody as a patient, and she first came to me saying, I don't really know what's going on. And she sent me these blood test results that came back, and I was shocked at the level that came back. It's normally I will see people that have symptoms of an underfunctioning thyroid, whether it's fatigue, tiredness, no matter how much sleep you get or exercise you get, weight gain, irregular cycles, dry skin, brittle nails, irregular bowel habits. Those things can come with thyroid issues, and sometimes people's blood tests are within normal. But in Melody's case, hers were 5 times off the top of what they even should be at the top of the range. So straight away I was like, okay, yes, there is definitely something significantly going on here. So what did the doctor then do when your results came back?
Well, I told her that I don't particularly want to take medication, but she said, look, basically she said you're going to kind of have to, and she was going to put me on a drug called levothyroxine. Hopefully I've pronounced that correctly. And she said, oh, well, I don't know how long you're going to be on this. I don't know how much to give you, but we're just going to put you on this I think it's a synthetic hormone to help your thyroid and brain communicate better.
Mm-hmm.
And that was it. And so I got the script and I never took it in the pharmacy.
Why didn't you? What was going through your mind at that time?
The whole vagueness of there was no here's the solution or here's what's going on with your body. It was just like putting a band-aid on, like taking Panadol when you have a headache, and the actual cause of that is perhaps not drinking enough water. So
Mm-hmm.
I didn't want to take the Panadol for my issue. I wanted to actually uncover the cause of the issue and fix that, so then I wouldn't be reliant on a band-aid.
So that, I can imagine, takes a lot of self-trust to be able to do at the age of 21. That's pretty impressive to be able to do. So when you had those thoughts, you're like, okay, I actually want to get to the bottom of why this is happening and why is this coming up high? Because it seems like my doctor hasn't told me why. It's just like, here you go, this is going to help support it. What did you then do? Like, where did you go? Did you Google things? Did you ask friends? Were you like, I have no idea what's going on, I'm broken, can this actually be fixed? Like, what was going on in your life?
Well, there's a bit of context behind this as well, and that was my now husband. Back when we were dating, he was on some sort of women's group and came across a book called The Fifth Vital Sign. I'm sure you've heard of it. Before I was married and close to the early marriage, I was starting to track my menstrual cycles, and because I had irregular menstrual cycles, they were way too long, and sometimes they wouldn't happen and I'd have mid-cycle spotting. And so I knew that these were really important to have children, and I wanted to make sure my body was in the best state of having children, as per my belief that marriage is basically for the purpose of having children. And so from that, I was also following a couple of influencers on Instagram, such as Dr. Nicole Lapara, who has how to do the work. So I was also addressing past trauma issues. I'd been to counselling and things like that. But also in that, a friend from high school, who happens to be your sister, posted a video that she had recorded with you about something to do with menstrual cycles. And because from reading The Fifth Vital Sign, I was really looking into understanding menstrual cycles more. What does it mean? How does it work? That I clicked on this video and started following you and started watching the content that you were releasing as it came out. And it was really helpful, a really practical way to understand the menstrual cycle, how stress plays a part of it. I think I specifically remember something that you did with 4 glasses in a row with different colours in it. And then, so when the doctor told me this is your thyroid issue, I decided to reach out to you and book in an appointment with you to uncover the actual causes behind the fatigue and the thyroid issues.
Did you talk to your doctor about the irregular cycles as well?
No, I didn't. I didn't think to do that, no.
It was mainly just around the fatigue that you were mentioning to them. Yeah. So for those listening, irregular cycles aren't a normal thing, as Melody has pointed out. And the book, The Fifth Vital Sign, is all talking about how your menstrual cycle is another vital sign. I just wanted to put in here that your whole body is a vital sign. Your menstrual cycle is, your bowels are, your energy levels, your hair, your skin, your nails, your tongue, everything. It's your symptoms that your body is telling you, aka what's my body telling me, is a way of us really going, oh, okay, my body is trying to tell me something and it's lacking something that it needs. So when you then decided, okay, I need to figure out why is this actually happening, you reached out to me, and then what sort of happened from there?
At the time, you had a little bit of a different system, unlike you do now, because of the growing interest in this. But at the time, booked a call with you and we went through some basic things, and then you helped me work together with the doctor to ask for specific blood tests and to provide the other side of things in that sense. So after that call, the very first call, we sent away for a hair test mineral analysis and waited for the results to come back from that. And once the results came back from that, we had another call where Anthea went through all of the results with me to show me what were the other contributing factors that were contributing to this thyroid issue. And yes.
How are you feeling in that? Because I know sometimes it's not a typical way that we handle our health. Often it's go to the doctor, they say yes, no, there's something wrong or not. Here's a medication, use this to help with it, or there's nothing wrong and go about your day, pretty much. So you sort of had a bit of a combination where they said you've got this issue, and on blood tests it did show definitely that there was an issue, and this medication that they were offering was definitely going to be helping. There's no doubt about it. However, it wasn't helping us understand why. So when you came to me and I was like, okay, we need to do this thing called a hair test, and I'm presuming from memory you didn't know, you'd never heard of it before and you'd never done it.
That's right.
What were you thinking? Were you like, okay, great? Or you're like, oh my gosh, is this even going to work? What's it going to show? Is this lady crazy? What was going on in your mind?
No, I was like, this is great. But in saying that, my family growing up was very health focused and you could say very anti-doctor. So I was sort of brainwashed into that, not trusting doctors. Not saying that we can't trust doctors, just saying that was my family growing up. So I was very open to a hair test. And from what you were telling me as well, I could see the logic behind it. It wasn't one of those like a fatty thing or a new agey, let's put hands on your head and sort of, some of those things that don't have scientific evidence behind it, whereas a hair test mineral analysis is actually scientifically sound.
Well, it's your body. We're assessing your body. It's much like a blood test. It's just testing a different tissue, a different substance from your body. Yeah, I think that's a really good point that you make. And I remember you, when you first came to me, saying, oh, I don't like doctors. I've never been to them before. I only went because I initially had this infection. And then I was like, oh, I'm fatigued too. And I remember, because recently what's been happening in the world, where some people were either on one fence or the other with what was the large infection, COVID, that was going on, I feel like it led us to use our beliefs and our bias to make decisions versus our body. So it was really great that you were able to go, okay, I'm going to use my body, and yes, I need to go possibly medicine, but then also I'm going to maybe look into, I'm going to do counseling and Nicole LePera and do the energetics and those unconscious patterns and beliefs that we have that are driving things, as well as going, well, maybe what's happening in my lifestyle and function, which is what we're looking at with the hair test as well. So yeah, I just want to again applaud you with going, okay, you looked at all of it and you did put your bias to the side, because we all grow up with biases, our family in different ways, our schools, where we live, everything like that. So ultimately listening to your body was an amazing thing. So your test results came back. What happened from there? What did it show?
Well, test results had my arsenic levels off the roof, off the scale, I think also 5 times at the top of the scale as well from memory. But it also showed the 4 main nutrients of calcium, magnesium, sodium and potassium, which are the accelerators and brakes, as I've learned from you, that they were quite low and decreased. It also, so from my understanding, my body wasn't coping to be able to excrete the toxins out of my body, and it also showed that I had a very fast metabolism, which which, yes, there's so much I could go into that you
Yeah,
could go
I guess
into here.
the overall feeling that you had from it, like you don't necessarily, I'm not expecting you to remember all of the things and give us a practitioner reading by any means, but you've done very well. A lot of that is definitely bang on. But what was the overall feeling that you had when you got the results back?
I was incredulous because just from the arsenic levels itself, I had no idea that there would be these heavy toxins in my body, and I thought my body was functioning perfectly. I did have that bias in my head that the thyroid issue was, there's something wrong with my thyroid and we've just got to fix that one thing. I didn't understand the interconnectedness between all of these moving parts, the nutrients, the menstrual cycle, the metabolism, the how our body excretes the toxins. So I just had this feeling of being amazed about the interconnectedness of the body, and also so grateful that I had done this, and to you to be able to explain and help me through it, that there was actually a reason why my body wasn't working properly, and it wasn't just in my head.
Yeah, and I guess that's an overwhelming feeling that I also had as well when I had looked into the functional thing. And that's what I always want people to remember is when you have been told there's nothing wrong, or people say this is just what's happening and we don't know why, it just means you need a different lens. You need to be looking at your body through a different way. And that's where it's not always going to be this type of test, but in your case, this was a really great way to look at and assess what was going on. A little bit of a health practitioner note here. For those of you who might be suffering from thyroid issues, Hashimoto's is an autoimmune condition of it. Melody also experienced elevated levels of antibodies as well, so it was Hashimoto's thyroiditis. Arsenic, a heavy metal, can play a large role in that, or any other heavy metal. So when you heard about the arsenic level, were you like, what were you thinking with that?
I was very surprised, but Jeremy, my husband, he immediately drew a couple of conclusions in his head that these are just plausible. They may or may not be correct. But both of us grew up on sheep farms, and back last century, they used to use a lot of arsenic in their sheep dip. It was later banned, I believe. Yet we know that arsenic remains in dust, in soil. It doesn't just go away.
It's a heavy metal toxin, unfortunately. Yeah.
Yes. And so perhaps from my working on the farm growing up, my husband also did the hair test, and his arsenic levels were even worse than mine. So it's perhaps residue from the wool, from the dust, working in yards and things like that, that was potentially the cause of the build-up in both of our systems.
Mm-hmm. Yeah. And particularly when we have heavy metals, just as a general rule, our body doesn't want to keep them in the blood because our body doesn't like heavy metals. So what it does is it tries to, close to the exposure, excrete it if it can. And if it can't excrete it by proper digestion, bowels, excreting through the stool and also excreting through a little bit through sweat and also urine, our body will store it in the tissues because it doesn't want it in the blood. So different heavy metals have different affinity for different tissues. Some go into the bone, some like the liver, some like the thyroid, some like the pancreas, some like the brain. So when we see high levels like that, the thing that a lot of people freak out and they go, oh, I have to get rid of it, I have to get rid of it, I have to get rid of it, which is, yes, we do want to get rid of it, but the general rule is low and slow. We want to do it slow because when we start to nourish the body, which is what we did in your case, which we'll touch on in a second, when we start to nourish the body, that's when our body feels safe to allow that heavy metal to release from the tissues and our body to excrete it. But if we don't have the pathways for our body to naturally function how it can, and we support those fundamentals, then our body will just hold on to the heavy metals, because a lot of us are exposed to heavy metals every single day, usually in smaller doses. And when our body's functioning well, it excretes them. But sometimes we're exposed to high amounts, and or our body isn't functioning well, so it can't excrete it in the first place. How many times have you been told everything looks fine while you still feel exhausted, bloated, anxious, have skin issues, period pain, and totally feel off? Without saying it, people are thinking it's all in your head. But you know something isn't right. Your body knows it too. And let me tell you, your symptoms, they aren't random. They're messages. Messages that blood tests don't always pick up because they only show a snapshot in time. Great when you're bad enough to need medication or surgery, not so great when you want to make sense of your body. If you really want to understand what's happening beneath the surface, that's where Test Your Fundamentals comes in. This isn't just another test, it's a functional health tool that gives you real answers. Using HTMA or hair tissue mineral analysis, it gives you a 3-month report card of how your body's been functioning, internally and externally, showing exactly why you're feeling the way you do. Unlike standard blood work, HTMA can detect nutrient imbalances, heavy metals, and deficiencies that could be wreaking havoc on your hormones, mood, metabolism, and gut. So instead of guessing what supplements you need or throwing money at another miracle diet, this gives you real, personalized answers about what your body actually needs. Here's how it works. You'll get a personalized HTMA test, a breakdown of your results in plain English, access to practitioner quality supplements, and a step-by-step lifestyle recommendations tailored to your 4 fundamentals. So you know exactly how to support your body your way. Your body isn't broken and it's always working for you. You just need the right tools to listen. That's what Test Your Fundamentals gives you. So if you're ready to stop guessing and start taking action, head to femalefundamentals.com.au and order your Test Your Fundamentals hair test today. There's also a link in our show notes. So, walk me through what you did. What did you change in your lifestyle after the results?
So firstly, we had a look at what was my diet mainly. There were some other parts that I'll mention those now. There were some other parts we looked at. For example, getting more sunlight, spending more time in nature, working on the energetics, which was also what I needed, not just to do with thyroid, but to do with anxiety and tenseness that I also had in my body. On the main part was the nutrients. And so we're looking at my diet, we realized that I was getting the nutrients that I needed, but my body wasn't utilizing it or wasn't able to utilize it very well. And so the main thing that we did was I started a 3-month supplement regime where the main vitamin that I needed was vitamin B to help my cells to utilize the nutrients that were coming in. I did make some other adjustments in my diet as well, and the main one being completely cutting out all sugar. In saying that, I still had honey, but people, each to their own on what you decide to do, but completely cutting out sugar also changed things so much for me, as in I could feel the change in my body. I was no longer up and down with every sugar time I ate sugar, because I was no longer eating sugar. I no longer, when I eat sugar, I will get acne very quickly, almost half an hour or an hour after, like instantaneously. And so I was no longer getting those acne from eating sugar and the vitamin B, and they were the main things I did, I would say.
So when did you start to notice that things started to shift, and how did you notice it? Like, what was your body telling you?
Quite soon after changing my diet and starting the supplements, I noticed that I was no longer feeling as fatigued as before. That was the main one. I would say the fatigue started up high and then pretty quickly dropped down. It wasn't like an instantaneous drop, but a slow drop over the coming couple of months. And I was again refreshed and refreshed for work, was able to have energy throughout the day. I was no longer needing to have an afternoon nap as I would often do.
Yeah, amazing. There you start to notice any changes with that fifth vital sign, your menstrual cycle?
Not at the time. They were still quite long. There was mid-cycle spotting. That became a lot rarer, but they were still incredibly long periods, yes.
Because were you tracking your basal body temperature at the time.
I was.
Do you remember what happened with your overall temperature?
I do. I'm just reflecting here. My basal body temperature began to increase. It was quite low, and I also wouldn't have the peak in the basal body temperature at ovulation, or perhaps I'd have a peak and then it dropped, and then I'd have another peak, and I couldn't understand what was going on. It did raise, but it was quite a while before I had a consistent. I would say I probably didn't quite ever have quite a consistent cycle until yes.
Until the next thing that happens, which we're going to allude to in a second. So why I wanted to allude to that is because there might be a lot of women that are listening to this that have thyroid issues or they want to fall pregnant, and you might be tracking your basal body temperature, you might have irregular cycles. And one of the things that the main thing that we look for in that is a peak, a spike of the basal body temperature around the mid-cycle to be like, you've ovulated. Because what happens is our body produces progesterone when we ovulate, and that progesterone raises our internal body temperature because progesterone increases our metabolic rate. When we think metabolic rate, it's literally just how fast our cells work. If you think about that like a car engine, the faster a car engine goes, the hotter it gets. The slower it is, the colder it is. So in general, if you're someone that's measuring your body temperature, your basal body temperature, across the whole time you're measuring, not just the middle of the cycle, and not just looking for that ovulation, if it's generally on the lower side, it is a sign that your body is struggling to generate energy. No surprises that you felt fatigued and that your cycles were irregular, that your skin was breaking out, that it was dry, that it had all the different things. So yeah, I just wanted to touch on that as well, because that's also another really cool way that we can understand what our body is telling us in a different way. So you did all these changes for the 3 months. Then what happened?
We did another hair test, and we also did another blood test. But the blood test was a little bit before the end of the 3 months. But at the blood test, my thyroid levels, the elevated one we were talking about before, that had come down to only 3 times above the
Optimal.
Thank you. And the hair test showed a massive decrease in arsenic in my system just in that 3 months. So they were the main two things.
Yeah. So for reference, if anyone, do you mind if I share the levels that you had?
Oh, that's fine. I've got them here too.
Okay. So when the TSH level, which is a brain hormone that tells the thyroid to work, it's called thyroid stimulating hormone. It's the brain trying to stimulate the thyroid. The top of the range, it alters in different countries, which is interesting in and of itself. But in Australia, if it's above 4, then generally it's like, well, there's an issue. The brain is trying really hard to tell the thyroid to work and it's not working. So it's increasing more and more and more and more, trying to tell it, and it gets higher and higher and higher, and the thyroid's not responding. So your level was 15, like 15.4 or 15.2 or something. It's 15. I remember seeing
At
it
the
going,
second
wow.
test.
And then the second test was 4.2.
The first test was 28.9.
Sorry. Wow.
Yes. Yes. And the second test was 15 on the second test. Yes.
Wow. And then the third test was 4.2, I think. It was just
Something
above
like
the
that.
normal. Yeah.
Yes.
So, yes. So it was very, very high in the beginning. Then it slowly had started to come down, which is amazing. And it just goes to show also how you started to feel in your body as well, having more energy, your cycles becoming slightly more regular, your skin not breaking out. Those things are a sign that your body is, whatever you're doing in your lifestyle is helping, because your symptoms are starting to fall away. So blood tests and having follow-up hair tests or having follow-up whatever type of tests is a great way to show objectively what's going on. But we can also pick up on that through our symptoms and go like, oh, I'm feeling a lot better. The general trend of how my body's functioning is getting a lot better. So whatever I'm doing must be working. So what happened so your second test was down to 15. What then happened afterwards? So you've done the follow-up hair test. We can see that your body's excreted a lot of that arsenic. All of your other fundamentals, your nervous system was getting better, your metabolism was getting better, all of your other nutrients, you were utilizing them more. Then what did you do?
Does this get to the good news part?
Yeah, you say.
uh, so at the time, both of us really wanted to have children and really wanted to fall pregnant. And so I just kept continuing these changes in the diet. Then I was in October, start of October, I was measuring my menstrual cycles. My period, well, no, my period hadn't come, but I knew from measuring my menstrual cycles, I'm pretty sure that's when I ovulated. And so I really hope I was pregnant and that I was testing every day to find out. And lo and behold, I fell pregnant with my now baby, and I've given birth since then, yes.
How amazing. I remember when you sent me that message and I was just over the moon for you. So how did your body fare in the pregnancy and birth, and what happened in the hospital? Give us a rundown in that.
So my body, I had morning sickness like no tomorrow. It was horrible, absolutely horrible. But my husband was so supportive and really helped me through that. That was in the first trimester. My body was doing fairly well. I had dropped back the supplements just to some minimum ones just to help me along, and mainly just focused on a lot of meat in my diet as well to help, and a lot of calcium, because I knew I'm growing a baby that's going to need a lot of those, as well as other nutrients, but specifically calcium. Will be taking a lot of calcium from my body. And
You added calcium through your diet. You weren't supplementing. Is that correct? Yeah.
that's correct. That's correct.
Yeah.
And I actually moved from Victoria to New South Wales at 36 weeks pregnant. So I had a complete transfer of hospital.
Wow.
But it was really good to see the two different hospital systems. One was a smaller, very small country hospital, and the other was quite a large centre. And in that, I learnt a lot about giving birth. At 36 weeks, once I moved to New South Wales, I did a prenatal course, which really helped to show how the body is working during giving birth, and I was able to prepare really well for that. My levels, all of my blood test results came back fine. There was no problems with me. The doctors, they kept asking me questions, trying to find, well, of course they're not trying to find, they're just trying to help you. But my bias, they're trying to find an issue with me, and they couldn't find anything. And every time, once I moved up here to New South Wales, I told them that I had Hashimoto's disease. I've been diagnosed with it. And after I'd given birth in the outside my door, and they had Hashimoto's disease ? They didn't actually believe that I had a autoimmune disease, that my previous doctor had told me, you're never going to get rid of this autoimmune disease. It's there for life. So it was incredible having that transformation, and knowing that my body is able to provide for my baby, that it's able to nourish the baby enough. Giving birth went really, really well as well. My body was able to do everything it needed. Not to say it wasn't painful, because it was so painful, but the midwife said this was such a great birth to be a part of. And they were so happy that everything basically ran to the book. In saying all of that, my body hasn't fared so well after giving birth, but it did really well during pregnancy.
In that, I want to touch on that postpartum as well, but how amazing that you, obviously in the beginning of pregnancy, morning sickness wasn't so great, but for them to then say, Hashimoto's, no, I don't think you have it, to be showing no signs. How did you tell them, no, they told me this? What did they say when you said they told me I have Hashimoto's? Did they say anything, or was it just on the whiteboard?
They didn't say anything there, but when I told them in the doctor's office, because I asked for my thyroid levels to be checked, they said, okay, we'll just put them on just for you. But they didn't believe me that I had an issue there. So, but they checked it for my benefit. And I think, again, it was actually within the range at that time. So,
which is an amazing thing, because when we fall pregnant and in postpartum, our body has to change dramatically. So when we are pregnant, a lot of people will say it's a detox process, meaning if you have heavy metals, if you have high levels of certain nutrients like copper or cobalt or something like that, what happens is your baby gets that. Your body actually releases it and it goes into the baby. So it's amazing that that obviously wasn't occurring for you because you'd cleared it already. And if you've fallen pregnant and you had them and your baby has them, it's okay. I'm not trying to fearmonger anyone, but it's great that you were able to do that, because sometimes people feel like they're fine. They don't have any health issues. And then they fall pregnant and they all of a sudden develop gestational diabetes, or they start to break out really bad with acne, or they start to get all these different symptoms that come out in pregnancy. Or sometimes we start to get all these symptoms come out after pregnancy in the postpartum phase. So it can be a really interesting way to go, oh, if I'm experiencing XYZ things at that stage of my life, that stage of my life is just magnifying the imbalance that was there. And I didn't notice it because my body was coping well enough. And then I added this stressor of pregnancy or of postpartum, because your whole physiology has completely morphed and changed, let alone your whole lifestyle now that you have a baby. There's going to be that underlying stress that wherever there's a sort of an instability in that foundation, it's going to come out. It's going to be magnified. So amazing that the Hashimoto's, because a lot of people get Hashimoto's either in pregnancy or after pregnancy. And the fact that you didn't is amazing as well. It's a sign that your body did have those fundamentals well taken care of. So postpartum, what's going on now?
I've really noticed in my body that it's really gone back to fatigue, even worse. I would say even worse than before. It's also, it's not, it can be more than what's going on in my body in terms of I'm waking up during the night to breastfeed my baby. So there is that as well, that I'm not, perhaps not getting as much sleep or a good 4-hour block of sleep that you need. But yes, the main things I've been noticing is very fatigued and starting to get the jawline acne as well. And those are the main two things. Skin's a bit more oily, and yes, the main one is my menstrual cycles. So apparently this is abnormal to happen for people that have given birth, but and who are breastfeeding, that is. I got my menstrual cycle back 3 weeks after giving birth, which apparently either 3 or 6, I can't remember which. But normally most women who are breastfeeding won't get their menstrual cycle back until they finish breastfeeding. It's not to say that it's a bad thing. It's just rare to happen, to my understanding. However, regarding my menstrual cycle, of which I've had quite a few now since giving birth, they're very short. They have spotting in between short from start to the next period. They're also...
What does short mean? How many days roughly?
About 15, I'd say. And then the length of bleeding is also around 3 or less days. I can't tell whether it's spotting or it's an actual period. So from all of these, I can tell that my body, from these symptoms, I can tell my body isn't functioning. Well, it's functioning perfectly. It's helping me, right? But it's telling me that it's worn out. It's telling me that I need to help it. I need to help it in my daily actions a bit more. And so those are the symptoms I'm experiencing, yes.
So because a lot of people in postpartum, I'm not lucky enough yet to have a child of my own, but I can definitely appreciate the huge lifestyle change that happens, and also from speaking to a lot of friends and family and my mum and relatives about what happens when you do have a baby. It's like they become top priority because they rely on you to actually stay alive. So how do you find balancing caring for yourself and caring for your newborn baby?
That's a great question. I would say, first of all, my expectation of what it would be like to be a mother was completely different than it actually is. I expected okay, this is my life. I'm going to have a baby. I'm just going to continue my life the exact same way as it was before, just add a baby in. But as you said, it's a massive sacrifice, really, because you're sacrificing all of what you want to do every day, all of your desires. You want to watch a movie, you want to go shopping, all of these things, and the baby becomes the top priority. So the first 4 weeks, I really struggled in that whole mindset, attitude, and heart set shift, and realizing, wow, this is what it's really like to give your life up for someone else, not to make an idol out of it in saying that. So how my life works now is I prioritize, I don't, in saying all of this, every mother will balance their life differently. Everyone does different things. This is just what I'm doing at the moment. I'm not working, but I will, to help me get what I need as well, is I will time my babies. When my baby naps, that means, okay, I'm going to nap, or I'm going to do some sort of task like reading or something, computer work or something like that, that doesn't require too much stress on me. And when my baby's awake, that's when I go and do the washing with him, go do the dogs, the chickens, all of those more physical tasks. So I balance what I need in working together with my baby to help us both. And with my husband as well, I'm very grateful to him, because in the morning he will get up, and most of the time he will cook us breakfast. So I will get some extra sleep, he'll cook us breakfast, and then I have some nourishing food to start off the day. Often I make easy lunches to eat, often wraps or things like zucchini slice that are easy to grab and eat. And then for dinners, I will prepare a really good, nutritious dinner that has, well, this again, everything I'm saying is for me specifically. So they'll be quite meat dense, and I generally don't have carbohydrates in the evening. I have them in the morning and the lunch, more protein in the evening. So that's the way I sort of balance some of those things, the sleep and looking after myself and the things I want to do, and the nutrients. And yes, now my mind has gone blank.
Breastfeeding brain as well, which is a very common thing to happen. Okay, let's take a quick body break. Notice if you're still with your body, or if your mind sprinted 10 steps ahead. Trust me, I've been there too, and it's okay. It does that. Let's just call it back. Take one slow breath and land your attention down into your feet. You're not behind, you're not too much, you're just here. And here is perfect. So it seems like, did anyone tell you, try doing this, like give hand down wisdom? Because I think it's a really great thing to have. I'm not even pregnant, and my mum hands me down wisdom all the time, in lots of different ways, but also in pregnancy and managing kids. And I guess, did you get handed down any information, and would you want to hand down any other information to any other women that might be in your position?
I did get handed down a lot of information from everyone, and
Was there anything that stuck with you?
no, because the thing is, every woman has information that is pertaining to them that they'll pass on to you, and you're not necessarily them. So of course you keep pockets of their wisdom here and there that you might utilize in your life. But I think that part of this is looking at that woman's life. Do you want the life that they have? Do you want the fruit on the tree that they have? And if so, then yes, you can take that wisdom. But if not, then throw it away. You're not obliged to keep that wisdom. In actual fact, though, some wisdom that has been said to me a couple of times recently is really look after your body in these childbearing years. You don't want to be sick and having children at the same time. Like, you really want to help your body, especially for myself, in terms of, I hope that we have more children. So it is very, very important. The, I think you have it in one of your videos that the ovulation, your ovaries, the reproductive side of a female is not prioritized. Your survival is prioritized, and then the reproductive cycle. So if your body is not working well, then you're not going to be able to have children. So that's really key to keep in your mind. And I think the other part of it is don't let somebody else's story be your own story, in terms of, yes, the women might say this or women might say that, but that doesn't have to be what you do. You don't have to go back to work, but again, you don't have to stay at home. There's no
There's no
ideal.
one size fits all.
Exactly,
Yeah.
exactly. And then, of course, the key is to go back to what your body is telling you, and always to be listening to your body.
Amazing. So it feels like you've got that really strong GPS self-worth. I know that this is where I want to be going, and I'm going to take bits of what other people are telling me and I'm going to leave the rest, because I know where I want to be going and what I want for my life and what's true for me. And then the rest gets filtered out. And then also you trust your body to know what to do and give it what it needs, which is
Exactly.
amazing. I love it. So I just wanted to end on a couple of questions. How, if you could be the creator of the healthcare system, and I know you gave birth to a baby boy, and men obviously do need healthcare, but obviously I speak a lot to women. If your next child was a baby girl, what would you want the world to believe about healthcare? Or how would you want the healthcare system to be for them?
Oh gosh, that is a great question. This is my opinion. I think that in schools, or whether you homeschool or go to public school, etc., that there should be a lot more taught about health and how our bodies work. For example, I didn't know anything about menstrual cycles until I read Fifth Vital Sign, and that was when I was 20 or 21. And I didn't know that you could only fall pregnant from a few days in each month. And so I had all these assumptions about menstrual cycles, about healthcare, all of these things. So I think if in our schools, and if you're teaching your children yourself to be educated about how our bodies work and to be able to pass that knowledge down. A lot of people have actually said to me, back hundreds of years ago, when people were giving birth, women would have known how to help another woman give birth. You would have had aunties and sisters, or men, who knows, I don't know, be there helping you give birth. We didn't necessarily have hospitals like we do now. And so if we can put some of that health information back into the hands of everyday people without needing to go and do a doctorate or a master's or any further study, to be able to understand the simple way of our body working, that's how I'd like to see the healthcare system working. Not so much in changing. I think our medical field does a great job, especially in treating broken arms and etc. Things like that. That you do need doctors. But it's more so understanding our menstrual cycles, understanding our different symptoms, how to help them. Is your body telling you need a bit more calcium in your diet? Is your body telling you that you're not handling stresses very well, and perhaps you need to go see a counselor and work through something? Yes.
Yeah. And I guess it is really the shift. What I'm hearing when you're saying that is the shift of trusting your body and understanding it and going, oh, it's not that it's broken if it's experiencing these different things, but maybe it is. And I do need support in a medical way. Or maybe I just need support in a counselor, or I need support in nutrition, or I need support in nervous system, or being outside, or whatever it is. But ultimately, what it sounds like you're saying is you're listening to the body and you trust it. You're not fearful of how it might feel.
May I make another comment here too, please?
Yeah.
That is, I used to have this bias. This is on a similar topic. I used to have this bias of the person down the street that's homeless, the person on drugs, the person that's getting drunk on alcohol every night. I was very judgmental of those people, but those people are just using substances to cope with something that's going on inside. So it's very similar to what's going on here. Are you using something to cope with? Are you using a drug, a Panadol, Band-Aid, etc., to cope with something that's happening internally? Or are you actually going to address the cause to overcome the past trauma, the past experiences you've had, the past hurts and offences that you've taken into your heart? Perhaps you've had codependency, all of these different things. It's not just about nutrients, it's about how our minds work as well to protect us in this world.
And that's where ultimately that's exactly the framework that I hope to embody onto everyone, is being able to utilize the energetics, which is the past, or the beliefs, the stories that we have about ourselves, the meaning that we make things mean, and how that changes our actions, how it changes our decisions, how it changes all of these things. And then ultimately, how do we actually care for our body? How are we meant to be moving it? What does it actually need? What nourishment does it need? All of the functional things. And then also going, well, actually, maybe I have a brain tumor and I need to get that investigated. Or I've been in a car accident. I'm not going to go see my psychologist straight away. Maybe down the track I will. But first of all, I want to go to the emergency department and make sure that's fixed. So, yes, I absolutely reiterate exactly what you're saying. So, final question, and it's tying into what we've just been discussing. What does listening to your body mean to you today?
Today, it means to me being aware of how my body is feeling and responding to it as quickly as I can. For example, if I notice that I'm feeling fatigued, then don't worry about all these other things that I have to do, but responding to that need. Another thing for myself is in the past, I wouldn't, this is before I was married, I wouldn't eat properly. And now I recognize that one of those things that I know when I'm hungry, because I know I'm hungry when I start to bite my lip. And so I know that I need to nourish my body because I'm listening to my body. It's, for me, listening to my body is being aware of what my body's telling me.
It's listening, it's having the awareness, it sounds like, and then acting on it, not pushing it down, possibly.
Yes, exactly.
Yeah.
Acting on it, not pushing it.
Yeah. Amazing. Melody, thank you so much for coming on and sharing your story. I think it's one that's definitely going to resonate with a lot of people in many different ways. So I just wanted to say thank you so much for always listening to your body, and always, it seems like, trusting yourself. It seems like throughout your whole journey, you've had this ultimate trust in yourself and taken action in that way. And I think that's been the thing that in lots of different ways has served you and has been the thing that has carried you through all of the different tops and turns and will continue to throughout the rest of your life. So thank you so much.
Thank you.
If this episode resonated and you feel like you're stuck in the space between symptoms and solutions, you're not alone. I've been there too, and that's why I created all of this. From the book, if you're just starting to listen, or the test if you want clarity your bloods couldn't give you, or the body-led experience if you've tried doing it all and still feel flat. Well, sometimes you need something specific, like one of our symptom series, for a deep dive support on topics like fatigue and menopause. So wherever you start, just know your body's already guiding you. Share this with someone who needs it, and don't forget to follow and rate the show. Please remember, this episode is for educational purposes only. Always consult a qualified health practitioner before making any medical decisions. Every body is different, and so is every healing journey.